Dr. Kara here. Wanted to bring out my Mr. Bones here. I think the kids call him Jim because he's no muscles, he needs to go to the gym. But I wanted to talk about full body chiropractic and just kind of explain a little bit about what that means, but also explain that it's very high in demand right now. So yeah, everybody's doing it. Why is everybody looking for a chiropractor that looks at the whole body? And let me just take a step back. They're not necessarily looking for just a chiropractor to do adjustments on the full body. We have doctor of osteopath, we have physiatrists, we have physical therapists that have gone on to get a full degree so they can do diagnosis. So there's many of us now coming together because we're seeing how important this is, okay? Many people for decades and decades and decades, like everything in science, have discovered that we don't know everything. And having a inflammation of the wrist or arthritis doesn't mean that the problem's in the wrist. We've got to get past that basic mindset when it comes to the body. So I was having a conversation with an outdated physician with some old concepts, and honestly we were arguing a little bit because if I get a report that says spinal work and chiropractic work doesn't matter, it doesn't work, and I tell people if I take your vertebra and slide it to the side just a couple millimeters, and if it doesn't matter and it doesn't need to be taken care of, then why would you mind if I were to do it to you? Because most people don't agree that I can go in and just, if what I do doesn't work, then it shouldn't bother you either. It shouldn't be able to hurt you because it does nothing, right? And I get a little, I don't want to say conflict, but I definitely go after that mentality because it's a one-sided thought process, is not thought out very well. So let's discuss it this way. If I were to take a knife and put it in this guy's neck, he would have disconnected spinal cord, maybe a numb arm, an arm that wouldn't work, maybe muscle that couldn't respond. And you guys know that. If somebody breaks their neck, they can be in a wheelchair, lose control of the rest of their body. So you can't tell me that you know that and then tell me that the spine and neck doesn't matter. Okay? If it's a little bit to the left, then you have a little bit of problems because of it going to the left. If you break it and it's completely displaced, you have a whole lot of problems with everything below it. So the severity of symptoms go hand in hand. But let me tell you this. If I hold my finger like this for 3 decades, what's going to happen to my pinky finger? Don't tell me nothing, okay? So I just kind of wanted to get over that memorized, this is how it used to be, kind of old school paradigm. So in order to get away from that old school paradigm, we have to understand why the new paradigm is so important, okay? So full body chiropractic is important because, let's go back to that wrist arthritis. If I have arthritis, which means excessive bone growth, minimal cartilage protection between the joint with friction and maybe an old trauma knocked the cartilage out 100% immediately, or every day, let's say this person's a Costco money counter and they're doing this, you know, taking those dollar bills and counting, and that movement is no big deal for 1 or 2 days or a week, but a year and then 2 years and 10 years and 20 years, that's a little percent over a long period of time. Both of those are equal injuries. Funny enough, behave a little differently, and the repetitive motion injuries are some of the most serious, sneaky, and they go under the radar, okay? It's the same saying, like, how do you boil a frog? You turn the temperature up real slowly, because if you did it fast, it would jump out. It would notice. So a lot of what's going around us health-wise, and who knows in other categories, is very sneaky. And it really takes knowledge and applied knowledge to get the truth. So, and let me tell you something, in medicine right now, we have a 40% chance of misdiagnosis. That is the true reason why people want full body chiropractors, full body osteopaths, full body physiotherapists, whoever you are. You know, I've studied many in many countries. I'm pretty open-minded. I'm not just stuck to one category, and been able to take that wisdom, apply it to the human body, and integrate it. So in our office, we start by seeing how the arch will catch the fall. So if you imagine this guy's entire body weight on this poor little foot, we want to make sure that that works perfect. And as we check all the individual movements, we know exactly which joint got stuck and exactly which joint is moving too much. So if you could actually see with your eyeballs that that's sitting in that position, you would know as a person who, without a medical degree, that probably isn't good. And that's a more neutral position, and then there's a normal range of motion where it shouldn't go past. Okay? If this ankle goes past the normal range of motion, you now have inflammation, muscle guarding, and as a patient, you don't need anyone to tell you where that is because your body is telling you where it is. Your brain goes, uh-oh, problem, let's swell, bring some nutrition to the area, tighten the muscles around it so now you have your natural brace, and your job is to go home and heal.